Welcome to the Sound of Ideas from IdeaStream Public Media. I'm Stephanie Haney. Thank you for joining us today. The longest federal government shutdown in history finally ended last week after 43 days, but the matter at the center of the shutdown remains unsolved. The fate of the Affordable Care Act tax credits that help make healthcare more accessible for people buying insurance on their own through the marketplace. An extension of those tax credits was not included in President Donald Trump's One Big Beautiful Bill, which was approved by lawmakers in July. So those subsidies are set to expire at the end of the year. A Senate vote has been promised for later this year as part of the deal to end the shutdown, but if there are no changes, millions of Americans are at risk of seeing very large spikes in their premiums, possibly even losing insurance if they can no longer afford it. Today, we're talking to experts about the cost of insurance going up, not only for people on the marketplace, but also for people on employer plans. We'll also hear from people impacted by those costs and ask, where do we go from here? Joining me for this conversation in studio, we have IdeaStream Health reporter Taylor Wisner, who has been covering this story. Thanks for being here, Taylor.
Sure.
We also have Jacqueline Schlapak, a Lorain resident who is self-employed. Jacqueline, thank you so much for coming in.
Thank you.
We appreciate it. And we have Katie Cook, the Senior Vice President of Employee Benefits at CBIZ, which is a professional services advisor. Katie, thanks for being here.
Thanks for having me.
Now, joining us by phone, we have Emma Wager, Senior Policy Analyst for the program on the ACA with KFF, which is a nonpartisan nonprofit organization that provides research, polling, and journalism on national and global health issues. Thanks for being with us on the phone, Emma.
Thank you.
Now, we would love to hear from you. If you have questions or comments about health insurance rates going up, you can give us a call. That number is 866-578-0903. You can also send us an email at soi@ideastream.org, or you can send us a message on Instagram at The Sound of Ideas. Emma, I'll ask you the first question here. The extended tax credits from the pandemic are expiring, so who is going to feel that loss the most?
So the people who are going to feel that the most are the people who have their insurance through the individual marketplace, also known as the ACA, exchanges, or Obamacare. And these are the people who get their insurance not from their employer and not from a public source like Medicare or Medicaid, but they purchase it themselves, either because they're self-employed, they work for or own a small business, or they don't get insurance through their employer or any other way. So these people are the ones who are really going to feel the expiration of those extended tax credits.
Taylor, you've been talking with people in Northeast Ohio who are buying health insurance on the marketplace right now. What are they saying?
Yeah, people are just really shocked with how high the premiums they're being quoted for their health insurance plans are. They're just really skyrocketing with the increasing cost of healthcare right now and just these subsidies falling by the wayside. So people are seeing, their premiums going up $500, $700, $800 from what they were paying just last year. It's causing people to really have a think about, maybe going with a lower cost plan, maybe even going with something like catastrophic coverage, or even forgoing health insurance just because they can't afford it.
And Jacqueline, you're one of the people that Taylor found in her reporting. So we'd like to hear from you now, whatever you're comfortable sharing. Currently we're in the open enrollment period for insurance, and this is when people can select insurance or keep their same choices. So can you walk us through what happened when you logged into the marketplace and looked at the premiums for 2026?
Yeah, sure. I experienced that the plan that I'm currently on is about 5 times what it was at the beginning of last year. I had an increase in the middle of last year and then going on there now at 5 times. And the only reason it's 5 times and not 7 times is because I actually had a decrease in my income. And so, every penny counts. And when I was weighing my options, I decided to decrease my coverage a little bit. That was one thing that I decided to do. I decided to forego my vision coverage, which, it's not like I'm weighing an expensive handbag. I'm weighing getting rid of something that's health related. And so, just finding that to be, just inhumane in a way. And just those costs are really shocking, and it really impacts people like me.
Vision coverage obviously a very important part of our overall health. For the people who are listening to this show and not necessarily watching it on Ohio Channel or on the IdeaStream Public Media YouTube page, Jacqueline is wearing glasses. So obviously something that's impacted your life, the vision coverage. Now, how did it impact your budget specifically when you decided to make that choice? You know, the coverage went up 5 times. Is that with the lower tier, or would that have been to keep the same coverage that you had previously that included the vision?
That would have been to keep the same coverage. The savings that I got by foregoing the vision coverage wasn't significant dollar-wise, but for someone low income, proportionately, it makes a difference for me.
And so, Taylor, when you spoke with others who are considering going uninsured or dropping some coverage, what were you finding that other people were experiencing?
Yeah, I mean, a lot of people are really thinking about potentially dropping their coverage, and that has a lot of risks. I mean, you know, I've talked to some people who actually kind of look at it from a numerical aspect, and they're pretty healthy, and so, you know, the idea is, you know, they'll pay out of pocket for their healthcare expenses and they'll work something out with their providers. There are some lower cost providers where you can find discounted care, like Metro Health in Cuyahoga County. But at the same time, you know, the reason we have health insurance is for those unforeseen issues. You know, you can't predict if you're going to get cancer or if you're going to get in a car accident. And those things, you know, can be really difficult to manage cost-wise if you're not on health insurance. And then the other side of that is when people who are pretty healthy overall drop off of these marketplace plans, that increases the healthcare cost for everyone as well, because, well, when people aren't paying their healthcare bills, that increases uncompensated care, which is a strain on hospitals. And then those other plans on the marketplace go up because they expect healthy people to drop off, and then they're having to pay out more for the folks that are sicker. So yeah, it's a vicious cycle, and one that at present moment doesn't seem to be working very well for folks.
Taylor, you've been covering this extensively. Thank you very much for explaining those ripple effects of that uncompensated care and then how prices will increase for other people because of that. I want to remind people that we are talking about the rises in health insurance premiums for people not only who get it through the marketplace because of the Affordable Care Act, but also people who have employer coverage for health insurance. So if you have a comment or a question, maybe you're someone who is weighing the decision of whether to continue with the coverage you've had or maybe drop coverage or lessen your coverage, please give us a call. That number is 866-578-0903. You can also email us at soi@ideastream.org. Emma, I'd like to ask you now, what options are there for people who are seeing their premiums increase? Are there any options?
Yeah, so almost everybody who gets their coverage through the marketplace is going to see their premiums increase for 2026. The most important thing that you can do is understand what your choices are. And the best way to do that is to work with somebody who is very, very experienced with the marketplace, like an agent, a broker, a navigator, somebody who can explain everything to you and make it in a way that you understand. There are options if you were previously on a more expensive plan with a higher premium. You can reduce your coverage to a bronze plan or even a catastrophic plan. There are trade-offs that come with making that choice. The main one being that you will have most likely a much higher deductible. So if you do need to use a lot of healthcare in 2026, and as Taylor was saying, there's really no way of knowing whether you'll need a lot of care or not. If you do need to, you will wind up having to pay out, you know, a much higher amount in terms of your deductible. That being said, I think that's still a better option than being completely uninsured, just because if you have a bronze plan with a $7,000 deductible and you wind up needing $30,000 worth of medical care, it's much better to have, you know, that $7,000 paid out of pocket than the full $30,000 amount.
Now, Emma, some Ohioans are looking at premiums that might be $1,000 or more per month. That's even for high deductible plans. Was it this high before the pandemic?
No, premiums have gone up quite a bit in the past 5 years, and they've gone up significantly just in the past year. We've looked at insurer rate filings, you know, when they when insurers decide to raise their rates in the marketplace, they have to submit to the state their reasons for doing so. And a lot of them have said, we are doing this because the tax credits, the enhanced tax credits, are expiring. And we anticipate people will drop coverage, and we anticipate that we will need to pay out more in terms of claims for the population that we are covering. So this is impacting the entire population as the rates will go up for everybody.
Katie, let's bring you into the conversation now. You work with small businesses, so what are they saying it's like to purchase insurance for the coming year?
Well, for a lot of groups, it's we're looking at their renewals can be between 12%, but I have some small businesses that have larger renewals of 20 or 30%. Part of the challenge with small businesses is, they can't, even if you have a 10% increase, it's not as if you can pass it on to your clients and or increase your product by 10%. So really trying to balance that, and how do we a lot of employers, they care about their employees. I mean, just it's the reality. So, how do you say to an employee, I'm going to increase the amount that you're going to pay that portion, even though employers pay a lot of that larger bill. They'll pay maybe 80% of the total premium, and the employees are only paying 20%. But to then say to an employee, I have to increase your costs by 10%, and oh, by the way, I'm not going to give you a raise this year, or you may get a raise, but it's offset by the cost, is very frustrating. We have groups that, right now we're seeing a lot of high medications that are causing part of the reason for that increases, as well as a lot of people, a lot of cancer, unexpected things, heart attacks happening, where those claims is part of the reason for the cost of that increase.
We have a call now from Janet in Cleveland. Janet, welcome to the Sound of Ideas. Go ahead.
Good morning, and thank you for taking my call. I appreciate that. We are a small business owner, and our premiums are going up 52%. That means for one single individual employee, no family plan, just a single individual employee will be over $1,100 a month. And as a small business, we can't absorb 80% of that cost and still pay our workers competitive wages. So my question is, what do we do in this? I mean, believe me, I feel for the people on the Affordable Care Act. I absolutely do. I think everyone deserves insurance. It should be a right, not a privilege. But my question is, as a small business, what do I tell my employees? We are shopping. Of course we are. But we're small.
Katie, I'll ask you to answer that question.
That is the hardest. That is the challenge that, unfortunately, it's not just that's dealing with it. A lot of employers are dealing with it. And what we're having to do is look at creative options. I mean, one of the things that we're fortunate in Ohio is we have a lot of options for small employers. We have the multiple employer welfare arrangements that all of the major carriers have aligned with different chambers in order to allow them to have those benefits. We also have a lot of programs out there called level funded programs, which are, they look and breathe like they're fully insured, but they actually underneath are self-funded. And then the challenge is that what she's dealing with is probably they're also looking at an individual coverage health reimbursement arrangement, which is also known as an ICHRA, where employers still are involved in providing benefits, but their employees will then go onto the exchange or onto the individual market, and they're going to make a decision, just kind of like Jacqueline, trying to decide what makes the most sense for me. So they'll give them a dollar benefit amount, and the employee will go out and they will shop their own benefits. And we've always, with a lot of my groups, like that's kind of the last path forward. You really want to exhaust all other options. But we're seeing more employers really looking at this seriously for the first time because it has become unaffordable. And just like you said, I have many groups that have 50% increases this year. I've been doing this for a long time, and it's the worst I've ever seen.
Emma, I'll ask you, do you have anything to add to the conversation about what small businesses can do if they're facing these 20, 40, 52%, like the instance of our caller, premium increases?
Yeah, I would just agree with what Katie said. I think that, there are some creative options that you can take, but overall it is just a really horrible situation for a lot of small businesses and small business owners.
We have a question now from Eliza. She had called in and also emailed in, and she's asking about Medishare health payment plan. So I'll ask you, Taylor, about that first. Have you looked into Medishare? Apparently, this is a system where people help pay for each other's insurance costs, which are different than regular insurance. Have you come across that in your reporting?
You know, I've heard people mention it as an option. I can't say that I've done a ton of research into it. This might be a good question for Emma, maybe, or Katie, if you're more familiar with this.
Emma, is there anything you are aware of when it comes to Medishare?
Yes, I've heard of some of these sort of health sharing organizations. They're a substitute for insurance that some people use. And the downsides of these programs is that they aren't really legally responsible for a lot of the same things that traditional insurance plans are. They're not really required to cover pre-existing conditions. They're not required to cover, and some don't cover specific conditions like maternity care. It's just a much more volatile option. These plans aren't ACA compliant. So it's something that I would say definitely do a lot of research in and understand what the trade-offs are if you're thinking about one of these plans.
I'll read an email now from David of Cleveland Heights. David writes in, I urge you to also pay attention to the next level of impact from people losing their ACA subsidies, ACA being the Affordable Care Act. I, for example, am a therapist working with many people who are getting their insurance through the marketplace, and some of them are already no longer insured at all while they are looking for other options. At least 2 clients are switching to new insurance plans on which I'm not in network, and they are also having to switch doctors and other providers. David says it's sad and the long-term effects of this are going to be seen over years. David from Cleveland Heights, thank you very much for sharing that perspective. Emma, I'll ask you, for people who are considering going uninsured because premiums are unaffordable, what are the risks that they need to understand in this moment?
Yeah, I think the main risk is that it doesn't matter whether you have insurance or not. Everybody is susceptible to sudden illness and sudden injury and things that will be very expensive to pay for out of pocket. So it's very important to understand that that's a risk that you're definitely taking if you have to be uninsured. And, you want to make sure that you have financially as much as you possibly can prepared for that. There's definitely, as David was saying, people may have to change their providers. You may find if you are uninsured that the prices that your current doctor or your current care team are going to charge you are much higher than someone else may charge you if you're paying for yourself. So you may be facing changing your care team as well.
We have an email in from Chris now, and Chris writes, my husband and I are self-employed with marketplace coverage. The plan we had in 2025 is not being offered in 2026. Chris got an email from something called Antidote, she says, sharing that the Centers for Medicare and Medicaid automatically enrolled us in its plan, which we had not chosen and in which our doctors don't participate. Needless to say, Chris says this was jarring to me. In reading the fine print, I don't believe this is binding and we can choose our own plan, wondering if the panelists have seen anything like this. And Emma, I'll start with you. Do you have experience with what Chris is talking about here?
I don't. That's an interesting situation. If you are enrolled in the ACA, the open enrollment period is active right now, so it should be your choice of your coverage. You should not be, pushed or cajoled into a specific plan without your knowledge or consent. That's alarming. So I would say definitely log into healthcare.gov, log into the portal, and make sure that you are in charge of the plan that you're selecting for yourself and your family.
And Taylor, for you, do you have any experience with what that emailer was talking about?
I haven't heard that yet, but, just to the point of having to switch your physicians and switch, maybe the provider that you're seeing. I mean, I know that's like an unfortunate issue, but it speaks to like a really big issue in healthcare too. I mean, when you make your change to provider like 30 to 45 minutes away from your home, it's a big barrier for people to get to the doctor. They might forego, a routine screening they don't see as important just because they can't manage it in their schedule. They may have long-standing relationships with their primary care provider that they can no longer continue. And there's such like an issue with trust right now in healthcare, with some people just feeling, that, with vaccine hesitancy and things going on, where trust of your doctors and having those relationships is so important. And so, even just to disrupt that is a really unfortunate circumstance.
I'll just share one thought as well on the note from Chris. Chris, thank you so much for emailing in. A lot of people are experiencing uncertainty when it comes to health insurance right now. I'm not familiar with a company called Antidote. I am familiar with email scams. I'm not saying Antidote is an email scam, but I am saying if you get information from an organization that you're not familiar with, it's always best to go directly to the source, do an internet search, and kind of see what's happening there. And I thought Emma gave great advice about going to the direct sources for the marketplace and other places so that you can make sure what you're seeing in one place is aligning with what you're seeing in other places. Just a great time for everyone to be very cautious with text messages, emails. Katie, go ahead.
Just something with that automatic, I think one of the things the marketplace is trying to do is if you're in a program, they're trying to make sure that you stay in the program. And often when times you sign up, you just automatically renew. You just think, oh, it's the same. And what I'd recommend to people is even if you're thinking you're renewing on your same plan, that you look at what is actually out there because it is constantly changing. And I have friends that are also on the marketplace where their providers were in the network, but because of negotiations and contracts, they're no longer in the network. So you can't make the assumption that what you think in 2025 is going to be the same in place for 2026. And it takes a little bit more effort, but I think it's worth going back out and rechecking everything and just making sure that you're in the right program.
I'd like to turn the conversation to employer-covered plans for a moment. And Emma, I'll direct this question to you. I think we have a good handle on why it seems that the Affordable Care Act marketplace premiums are rising. We know that those subsidies are ending at the end of the year if Congress doesn't act. But Emma, why are premiums rising for employer-covered plans right now?
Yeah, so we asked a bunch of employers this question in the KFF Employer Health Benefits Survey this year, and they had a variety of answers. Many of them said that it's prescription drug prices and hospital prices that are causing them to need to raise their premiums. These are very expensive services, and as employers have to cover all of these products and services for their employees, and the prices keep going up, they're going to have to be raising their premiums in order to cover them. We've seen a large uptake recently in certain very expensive prescription medications, including primarily these GLP-1 agonists, such as Ozempic, Wegovy, that people are using for diabetes and for weight loss. So employers who cover those drugs have found that, there's a high demand for them among their employees, and it's an expensive thing for them to cover. There's also I think about 30% of the large firms in our survey said that the prevalence of chronic diseases is contributing to their higher premiums. So, people just are sicker, they may be a slightly older population, and they have higher health charges because they have more health problems.
We have a call now from Tim in Lodi. Tim, welcome to the Sound of Ideas. Go ahead.
Oh, hey, good morning. I'm the curmudgeon. I can remember back in the 90s when Gingrich was demagoguing reform, when the Clintons were trying to get something through. So this is just, the chickens coming home to roost. The only way they're going to solve this problem for generations to come, because I'm getting older now, and it's almost moot because I'll be dead before they fix it.
Tim, I think that our connection might be a little spotty there. I would love if you would call back in so that we can make sure that we hear your comment. But we can't really make out what you're saying right now. So maybe you want to hang up and give us a call back and see if we can get a better connection with you. That was Tim from Lodi. Thank you very much. And Jacqueline, I think from what I could make out from Tim's conversation, he was talking a bit about times from the past. So you've said this moment in time reminds you of before when the ACA existed and when pre-existing conditions impacted the cost of your healthcare. Tell us about that.
Yeah, so funny story. I've been in healthcare as a provider for 29 years, and I've never had employer-provided health coverage. So from the time I graduated college and worked as a dental hygienist till now, I've always had to get individual coverage. And so I remember the days of being a female was a pre-existing condition. The premiums were super high. The deductibles were very high. There was no such thing as a health savings account. Once you hit your deductible, it was 50% coverage. And so, going back in time is really not an option, but it's scary because I fear that we might be going backwards. It was just, the Affordable Care Act did make it much more affordable. I think there are still issues, of course, but that past experience was just so draining and so expensive. I mean, I would every year pay more than 10% of my income towards medical costs between premiums and care.
We have Tim from Lodi back again. Tim, go ahead.
Oh, good morning. Hopefully this is better.
It is. Thank you.
I can remember back in the 90s when Gingrich was demagoguing the Clinton reforms, and then Obama got in there and picked up the Heritage Foundation's reform and created the Affordable Care Act. And now the Heritage Foundation, the authors of 2025, are out there poo-pooing the system. So as I get older, it almost turns into a tragic comedy on how they're dealing with health insurance in this country. They just need to take the pill, the blue pill, and go to a single payer system. The problem is, what are you going to do with all those insurance people that are going to lose their jobs because of the efficiencies that are going to come into the system? Everybody knows who follows this is that about 20% of the cost of health care is just paying paper shuffles. If they go to the Medicaid for everybody, it's about 3 to 5%. So, it'll create the problem is just once you politicize health care, then we're gonna go right back to where we're currently at with all this other demagoguery that's going on with reality. That's my spin on it anyway. But I'm getting older. So I think that's the main problem is because most people, as you get older, you just figure you're going to be dead, and you just don't want to invest any time or energy in this or put any of your skin on the table. That's my spin on all this.
Thank you very much for calling in, Tim. We appreciate you sharing your perspective. Emma, I'll ask you, can you talk to us about reforms that you've seen reported on?
Yeah, so there's been a few things that have been floated. Obviously, the Senate is promised to vote in December on some form of changes to the ACA. So there's been discussion of a couple of potential ways that some of these tax credits may be extended slightly. There may be a cap at a different income level, but it's very difficult to say right now what's on the table and what the outcome may be. There's been some discussion about HSAs, which are health savings accounts, which would be giving people money directly into an HSA that they could then use on premiums, they could use it on out-of-pocket expenses. And it's unclear what impact this would have just because it doesn't really address the underlying driver of the cost of insurance, which is the cost of the healthcare itself. It's the prices that hospitals, physicians, and other providers have to charge is just very expensive, and it's unclear what is on the table to address that.
We have an email now from Stephen who writes in, I work for a major international employer, and over the last few years, our premiums have been creeping up while the quality of coverage gets degraded. They try to spin it as improvements, but they're obviously steering everyone towards their preferred plan. On top of that, raises don't keep up with inflation, and they keep expecting more productivity. Stephen, thank you very much for sharing your perspective with us here on The Sound of Ideas. Taylor, I'll ask you, in your reporting, what can you tell us that you've seen about the impact of inflation in this specific area?
Yeah, I mean, inflation affects healthcare costs as well as everything we're seeing in the environment. I think, Emma mentioned, medication and other factors that are making healthcare more expensive. But one of the things I've heard too is just workforce costs. I mean, employees cost a lot, and doctors provide and nurses provide essential services. And so, there's always competition for healthcare providers. And I know that's like the one industry that they're always looking to increase their workforce in. So, yeah, I mean, we're seeing these pressures everywhere. You know, we go to the grocery market, we see, you know, how things are getting more expensive, and they're affecting our healthcare too. And also, as Emma said, real quick, you know, with the cost of medications going up and more chronic conditions, people got a lot sicker after the pandemic. People didn't go to the doctors much. They didn't get those screenings that they may should have, and so now as they're being treated, they're sicker than they could have been had they had that care all along. So. There's a lot of factors at play, but I don't think our healthcare costs are going to go down anytime soon.
And I'll ask you, Taylor, you've done reporting on how healthcare is changing in the region in general. So how might future Medicaid cuts impact healthcare here? We're talking in terms of hospital closures, maybe services ending. What is it that you see from your reporting?
There's a lot of concern with rural hospitals about how they're going to manage. There's at least 10 hospitals, I think, in Ohio that are already sort of on the verge of closure, just given, their margins. Margins in healthcare in general are just very tight. So things like Medicaid cuts can just be such a blow to the system. And I've done a lot of reporting, too, on Metro Health Medical Center. The Metro Health system here, the Safety Net Hospital in Cuyahoga County, they're dealing with a huge rise in uncompensated care. It's $1 million a day, and I think projected by the end of 2026 to be $446 million in the cost of care that's not paid. That's a very difficult hill to overcome, and things like this where people may go off their insurance. Maybe not all of the types of patients that go to Metro Health, but maybe some. In addition to those Medicaid cuts, I mean, they're just looking at a kind of perfect storm of trouble. In addition to the county having to slightly cut their fee that they're providing Metro Health for that uncompensated care. So it's definitely hitting hospitals hard right now, and especially those who take care of people who don't have that employer-provided health insurance.
As we wrap up this conversation, I'll ask everyone on the panel now to share with us your takeaway of this moment and, your thoughts moving forward. And Emma, I'll start with you.
Yeah, I think a lot of people are just going to have to pay significantly more in 2026 than they did in 2025 for their healthcare, particularly if they get their healthcare through the ACA exchanges. And that's just an extremely difficult thing for a lot of people. It's going to affect a lot of family budgets, and people are going to have to make certain sacrifices. And, it's obviously not an ideal outcome. But I think people should know that they are free to switch their plan through the end of open enrollment, which is January 15th, 2026. So to keep an eye on what's happening in Congress, and to make sure that you understand, if there is any changes to the tax credits, you are free to go in and switch your plan, even if you've already enrolled in something for the upcoming year.
And that open enrollment period is for people on the marketplace with the Affordable
Yes.
Care Act, right? That's different for people on employer-covered plans.
Yes, this is the ACA open enrollment period.
Thank you, Emma. And Katie, I'll ask you for your takeaways.
I would say for small business owners is just making sure that they find an advisor to work with that they trust, and that if you're a sole entrepreneur, there actually are a lot of options available in Ohio that if you're in other states are not available. And sometimes people don't realize that they have those options. So to reach out to an advisor and talk to someone who's an expert, because it's very difficult to, if you're a small business owner, you're trying to be an expert in your industry. You don't need to be an expert in healthcare, so find someone who is.
Mm-hmm. And Taylor, from your reporting, what are you taking away from this moment? What do you need to keep an eye on right now?
Yeah, I'm definitely going to watch what happens in Congress in December, and any healthcare reforms that maybe haven't been proposed yet, and see what happens there. And I'm going to continue, talking with people in the community about sort of the choices they're going to have to make with these healthcare costs. So I always say, feel free to reach out to me if you hear this segment and you have a story to share. My email is on my website, but yeah, we're definitely going to keep focusing on this and looking at the ripple effects.
And Jacqueline, for you.
Yeah, I think it's just about acceptance, is that things are more costly. And so just accepting that that's the way it's going to be for a while, because it's not a simple problem. And so there's really not a simple solution.
I want to thank you all for participating in our conversation now. Thank you to our guest, Jacqueline Schlappak, a Lorraine resident who is self-employed. Thanks for being here.
Thanks for having me.
We have Katie Cook, the Senior Vice President of Employee Benefits at CBIZ. Thanks for being here.
Thank you for having us.
On the phone, Emma Wager, Senior Policy Analyst with KFF. Thank you very much.
Thank you.
And our IdeaStream Health reporter, Taylor Wisner. You can check out more of Taylor's reporting on this topic at ideastream.org. Taylor, thanks for being with us.
Wish it was a little less bleak of a situation, but I'm happy to be here and to have Jacqueline and Katie here to talk about this too.
Thank you for keeping us informed. It is truly essential, and we appreciate it very much. All right, we'll take a break now, and when we come back, we'll talk about public corruption and its impact. It's a topic that both developed and emerging nations need to confront, and it's the focus of a cross-cultural dialogue happening in Cleveland today. This is The Sound of Ideas. I'm Stephanie Haney. We'll be right back. You're with The Sound of Ideas from IdeaStream Public Media. I'm Stephanie Haney. Thank you for staying with us. It's estimated that trillions of dollars that would benefit the public are lost each year due to public corruption. That's including bribery, embezzlement, money laundering, and tax evasion. Today in Cleveland, the topic of corruption and how to address it will be the focus of a panel discussion. This is happening at the annual meeting of the Council for International Programs USA. That's a nonprofit organization founded in Cleveland after the atrocities of World War II by a Jewish man, and the group has gone global. Its mission is to promote international understanding through professional development and cross-cultural exchange programs. The Jones Day Law Firm is hosting the meeting and the panel today, and some of the participants of the panel are here with us today to talk about why fighting corruption is so important for the public good. Joining me in studio, we have Justin Herdman, who will moderate the panel. He's a partner at Jones Day and also a former U.S. Attorney for the Northern District of Ohio. Justin, welcome to The Sound of Ideas.
Thank you, Stephanie.
We also have with us Veronica Dragolin, who will speak on the panel. She's also a partner at Jones Day and the former chief prosecutor in the Anti-Corruption Prosecution Office for the Republic of Moldova. Veronica, thanks for being here.
Good morning.
Now, if you would like to join the conversation, you can give us a call. That number is 866-578-0903. You can also email us at soi@ideastream.org, or you can send us a message on Instagram at The Sound of Ideas. Now, Veronica, corruption is a word that gets used a lot, especially in polarized politics. So how do you make people care about it and not just tune it out every time they hear it?
I definitely think bringing it to our everyday life and realizing that when some money exchanges hands between, let's say, a public official and a private company, it's not something that doesn't touch the rest of us. I think it's particularly stark, and you can see those effects in countries like Moldova, Romania, some of the other sort of newer democracies in the world where corruption being so endemic leads to people being afraid to invest in those economies and those countries because it becomes unpredictable and it becomes too risky to know that public officials could potentially ask you for a bribe and to be able to get a permit to build a building or something like that. And it incentivizes, if corruption gets sort of out of hand, the promotion of companies that are willing to break those rules at the detriment of companies and employees that are honest and unwilling to play by those types of corrupt schemes. So it tends to have a really terrible economic effect in a particular region, and for that reason it's so important to constantly push back on it in that part of the world, but also here in the United States in terms of making sure we have a respect for the rule of law and that's what really governs our society in general.
And when we talk about corruption, can you tell us, so that we can kind of try and make this as real and tangible for people as we can, about the impacts on public safety and also personal prosperity?
Sure. So in terms of public safety, I mean, sometimes, for example, if a company were to pay bribes to an inspector, a building inspector that's coming in to be able to make sure that everything's up to code, the fire code or building codes, if a company decides to cut corners and instead pay off that public official and the official accepts the bribe, what you're then doing is permitting a building to go up that violates some of those safety codes that have been set into place, and that could potentially potentially lead to catastrophic results, including public safety issues for the citizens affected by something like that. So it certainly has the potential to really lead to devastating effects.
Justin, I'll ask you about your time as a U.S. attorney. And in your time there, what was the volume of corruption cases that you were seeing?
It was significant. It was a constant area that we had to focus on. And I also want to say, not every case that came in either to the FBI or to our office ended in a prosecution. There was an investigation. There was determination of whether or not there had actually been any corrupt activity. And more often than not, we elected not to pursue a case in court because we didn't have sufficient evidence or we didn't think that a crime had been committed. But the volume was still pretty steady. We had a unit that was devoted to investigating and prosecuting white-collar crime and corruption, and we also handled that out of our branch offices in Toledo, Akron, and Youngstown. And so unfortunately, the reality is that even here in the United States, that type of activity is still underway. It seems to be focused usually more on the local and state level, but any level of government can be subject to corruption and bribery.
Here in the U.S., Justin, an independent judiciary is a main part of our system of checks and balances. So as a former U.S. attorney, how are you feeling about that level of independence now in the country?
Yeah, I think, when you look around the country and if you have policy disagreements with the administration, and I think this would have gone the same way in the past administration, those policy disagreements typically end up in court in some way or another. Just last week we had arguments in a case involving tariffs, and those were argued at the Supreme Court. And I think the level of scrutiny that administration actions get from the judiciary should give confidence to the public that the judiciary is very active in these litigated disputes and is not afraid about being skeptical of administration action if that's deemed to be against contrary to the Constitution or prevailing statutes. And we do, I think, see, particularly on the federal level, a judiciary that is acting independently, despite what you may think based on political disagreements and policy disagreements elsewhere in the country.
Veronica, I'll ask you now. A delegation from Romania will be part of the panel discussion today that's being hosted at Jones Day Law Firm. So what can you tell us about the landscape for nations like Romania and Moldova when it comes to corruption and confronting it versus how it happens here in the United States?
It is different in terms of the historical context of those countries versus the United States. There, I think no one would disagree with the concept that corruption is much more endemic in terms of sort of touching everyday life, from the lowest levels to the highest levels, including things like going to the doctor's office, being expected to pay something to the doctor out of pocket, or paying a police officer that maybe stops you for a speeding ticket. I think those countries, Moldova, Romania in particular, have made huge strides in the past in terms of rooting out some of those everyday types of schemes, but it's a challenge. And I think for me, having practiced as a prosecutor here in the United States in the federal system and then practicing in Moldova, the biggest difference, the starkest thing that stood out was corruption within the justice system itself. So in Moldova, it was very common to catch sort of in the act a prosecutor accepting a bribe, judges accepting bribes. We investigated those types of cases and captured it on video. That's not the type of thing that you hear about here in the United States. And I think trying to battle corruption with the system where the people themselves that are responsible for enforcing the rule of law are susceptible or sometimes compromised makes that much more of a challenge. And fortunately, I think here in the United States, those types of cases are very far and few between in terms of judges taking bribes, prosecutors taking bribes in cases, and especially in the federal system.
Thank you for drilling down on that, and especially your experience with what was happening when you were prosecuting cases in Moldova. I just personally think it's interesting to think about the concept of having to pay a doctor when we talk about corruption. I think high-level corruption, a lot of people think of deals being done in back rooms in politics, but not necessarily those necessary services that you need access to in your everyday life. It's wild to think about. Now, I want to remind people that we are talking about corruption in light of a panel that will be happening. It's a cross-cultural conversation that will be hosted at Jones Day Law Firm today. If you have any questions about corruption in any facet or a comment you'd like to share, you can give us a call at 866-578-0903. You can also email us at soi@ideastream.org. Now, Justin, every administration, when it comes into power in the U.S., sets its own judicial priorities. So can you talk about that process and how it impacts the work of the Justice Department, particularly agenda setting? Does that have an impact on the legal process?
Yeah, and I think if we're talking about corruption, we're probably talking about the Foreign Corrupt Practices Act, which is a statute that's been on the books for, I guess, 50 years now. Prohibits U.S. companies from paying bribes overseas to secure business or for a variety of other reasons. But early on in the administration, there was a pause in FCPA, the Foreign Corrupt Practices Act, enforcement activity, and then a revision of guidelines for prosecutors on how to pursue those cases. And it's very typical for any new administration to reprioritize DOJ resources. And we saw that again here with the guidance that was promulgated with respect to the FCPA. What the administration has said is that the Foreign Corrupt Practices Act will still be enforced, but that the prioritization will be on bribes that are paid with respect to drug cartel activity, transnational criminal organization activity, human trafficking and smuggling, tariff evasion, those types of offenses, as opposed to what the administration has said is prosecutions that would disadvantage American companies. And so, again, this is the kind of thing that we typically see administration by administration. In a couple years, if there's a Democratic administration, we may see a change back to more historical trends with respect to the FCPA and prioritization of more typical FCPA type of offenses.
Veronica, I want to ask you, what kind of tactics did you find to be most effective during your time in Moldova when you were addressing corruption and improving public trust?
I think two aspects that you touched on. So in terms of actually being able to prove a corruption case, as we all know, normally corruption involves two parties, and they both have a self-interest to not have their agreement come to light. So it's actually very challenging to uncover those types of things. I think whistleblowers and sort of encouraging people to come forward, creating incentives for cooperation are good tools to actually be able to uncover these schemes. And also having, in most cases, we sort of need direct evidence because oftentimes various maybe, unsavory business dealings that we might not like do not cross the line of becoming criminal in terms of corruption. So as a prosecutor, having to look very carefully at, is this type of conduct something that maybe breaks some ethical rules, but not actual criminal law. So being able to actually record conversations. And again, you can only do that if you have a cooperating witness who's willing to go in there on the inside and do that. And I think that I've seen that both in the U.S. system and the Moldovan system, being able to incentivize cooperation on behalf of companies as well as individuals is a great way to be able to uncover the most serious types of crimes. And then the second part of your question, when you touched on public trust, I think a big part of that is being able to be transparent about the decisions that are being made by a prosecution office in terms of why prosecute a particular case and not a different one, so as not to be susceptible to criticism that the office is being favoring certain types of individuals or people versus others. And so in the United States, I think we have a system that's quite good at giving the public access to filings, right? Being able to read an indictment, being able to read the motions that get filed in court. Whereas in Moldova and Romania and other parts of Europe, the public has less access to that. So I think building public trust, you can do that through transparency and being able to justify decisions based on the law.
Veronica Dragolin and Justin Herdman, both partners with Jones Day, thank you very much for being here and being a part of bringing this conversation on corruption and anti-corruption to Cleveland today.
Thank you.
It was a pleasure. Thank you.
Thank you for your time. Now, to get the last word on today's topics, you can send an email to soi@ideastream.org, and you can find us on Instagram at The Sound of Ideas. Yesterday, we talked about changes to sports betting rules in Major League Baseball following indictments of Cleveland Guardians pitchers Emmanuel Clase and Luis Ortiz for allegedly rigging bets on pitches. Mitzi wrote in, "Why would two young men of acknowledged skill and talent risk their valuable careers and futures for such small cash payoffs? Are violent people threatening them or their families with physical harm? This is what makes sense to me." Mitzi, thank you for sharing your thoughts on that. David from Twinsburg also emailed, to quote the great philosopher Gomer Pyle, "Surprise, surprise, surprise. Who knew that when betting became so pervasive that players and fans would push the limits? Legal sports betting is one of the dumber decisions our political leaders have made in a very long line of dumb decisions." David, thank you for sharing your perspective. Tomorrow on The Sound of Ideas, we'll take you inside the plea deal in the Bobby George domestic violence case with Special Prosecutor Jane Hanlon, who handled the case. We'll get the point of view of a criminal defense attorney from Terry Gilbert, and we'll hear from plea bargaining expert, former Ohio Supreme Court Justice Michael Donnelly. If you missed any part of today's show, you can listen to the Sound of Ideas podcast or watch the show on the IdeaStream Public Media YouTube page, and you can hear a rebroadcast tonight at 9 on 89.7 WKSU. I'm Stephanie Haney. Thank you for keeping the conversation going. We'll see you back here tomorrow on The Sound of Ideas.